2020 president for the SAR. Welcome to the Friday afternoon roundtable. We are blessed to have Dr. Bob Lutz with us of the Spokane Regional Health District. We're hoping he's going to give us a little bit of insight on what phase 2 of our re-entry into the real world might look like, and any suggestions he might have. Please know that these proceedings today will be recorded. If that's an issue to you, you probably don't want to be with us, but we are going to record these for people to look at later and take advantage of later. Also with us today is Matt Seid, broker owner of Realty One Eclipse and the 2020 president for YPN, and we'll have a little conversation a little bit later on COVID-19 and YPN and protocols and procedures and challenges and things like that. So Darren, as per usual, Darren Watkins is our moderator extraordinaire and government affairs director for the SAR. Darren, please take it away.
Thanks so much. So it's been a very busy week. As you know, we've been talking a lot about phases for reopening. Just a quick update for realtors that we have been included in phase 2 of reopening. And while there's not been any specific guidance from the governor's office, at this point, we are looking at following the professional standards that were set out. And we've got Dr. Lutz is here today to talk a lot about what's going on in Spokane and maybe to help put together some guidelines of what phase 2 is going to look like and what we can expect. Dr. Lutz, thank you so much for joining us. It's been a busy month for you.
Yeah, busy 2 months actually, Darren, but thank you again. Good to be here. And I obviously met with Tom a little while back. It was a little bit more relaxed at that time, but obviously things have progressed somewhat. And I think, yeah, Darren, definitely it would be my understanding that certainly realtors would fall under the phase 2 professional services document. I don't see realtors included in it, but it certainly seems appropriate given, the other individual, sectors, accountants, architects, attorneys, engineers, et cetera. So it all seems appropriate that would be where realtors go. The document is pretty extensive, and I would encourage everyone to take a look at it and get ready. I think that it's going to require some differences going forward than maybe how you've been working in the past. I think the physical distancing piece, challenging, and are you going to be having people drive separately and things of that sort? I think the the mask wearing is something that we are already talking about. There's already a little bit of pushback that I've been receiving about trying to declare that masks are a necessary piece of your wear as you're going about your day. But I think certainly going forward, when I look at the research, I know it's also being done in Seattle that, again, for me, as I've said, today a couple of times, science doesn't proceed linearly. It proceeds oftentimes in fits and starts. And early messaging around masks was, well, the cloth masks really don't make a difference. The reality is that it doesn't necessarily make a difference for me getting infected from you, but it prevents me from infecting you. And if you're also wearing a mask, then you're protecting me. And so collectively, we're protecting each other. And so I think probably going forward, some of the changes that you will be looking at doing will include, again, providing as much opportunities for that physical spacing as possible, albeit it's not always going to be possible. You may find yourselves having to take separate vehicles. And again, I think when you're in close proximity to individuals, as you will find yourselves in, both while showing homes as well as in the office spaces, masks are going to be one of those things that you are going to be, strongly encouraged to use. Combine that with the guidance around, hygiene, the typical cough etiquette, as well as frequently touched is frequently cleansed with appropriate disinfectants. And so that's, I think, the best guidance that I can give you right now, but I would definitely, if you haven't looked at it, definitely reference phase 2 professional services document. I do believe that's where you're going to get your guidance going forward.
Let's just take a quick benchmark of where we're at. I mean, are you pleased with how things are progressing? Still concerned? I think the last check-in, we had 2 new cases today, 2 yesterday, but before that, a couple of days in a row, we didn't have any new cases. I would love to hear from you what your thoughts are about where we're at. We're doing enough testing. What are you thinking?
Sure. Yeah. All great questions, Darren. Thanks for asking. Yeah, I think as I've shared over the last couple of weeks, I think our numbers have been looking very encouraging. Again, we also know that's a function of testing. If I don't test, I don't know. But I think our testing has ramped up a little bit, especially given that a couple of weeks ago we loosened the criteria for testing and more people are going into clinics and getting tested, which is encouraging. So I want to say early last week, I may have had a little bit over 9,000 tests performed. I'm now up over 11,000. And so we're definitely seeing an increase. The fact that I'm seeing increased testing, the fact that I'm not seeing increased cases, for me is encouraging. And one of the metrics that we use is what's called a positivity rate. So what's the percentage of positive tests that are done? And there's been some suggestions as to a good number, and it tends to be less than 5%. And so almost from the get-go, our testing percentage positivity rate was about 4.5%. Currently, it's down to 3.5%. So the fact that I'm seeing more testing, the fact that my positivity rate is going down, for me, that's really encouraging. What I always get concerned about are what we call outbreaks. And outbreaks for COVID is defined as just more than 2 people in a specific setting. And so to date, we're fortunate. We're not like we're seeing in Yakima County or Kittitas County or Benton Franklin or even Walla Walla, where they've had significant outbreaks in farm workers and individuals working in meat plants and things of that sort. We're fortunate that we don't have those industries as major contributors to our base here. But I do have long-term care facilities that are of concern. As you know, we've had a couple of outbreaks, obviously the most significant one in the Veterans Home, but I feel as if we have pretty good containment of that, knock on wood, going forward. So I think our numbers are good, but numbers can also give people a false sense of security. And I guess that's my biggest concern going forward. The fact that we've continued to have relatively low counts, low hospitalization rates. I have 3 people in the hospital right now, which is great. The fact that people are not seeing a whole lot of cases, that then gives them the sense that, well, COVID-19 is not here, and then we can relax. And I can't really encourage that approach right now because relaxation will allow us to go backwards rather than forwards. And so I think, for you, given the roles that you play in our community, given the fact that you're interacting with people, the fact that you are message bearers, I encourage you to encourage them to do the right thing for each other. When you're out and about, wear those masks, continue to physically distance, continue to do everything you can to really keep our numbers going in the right direction.
What's your estimate of how many active cases we might have? I mean, I know we keep cumulative counts, but clearly a lot of those have already been through the cycle, have already been, past any risk. What's your thoughts on how many active cases we might have in Spokane County?
Yeah, that's a really tough question to guesstimate, Darren. One of the things we're really interested in doing is some sort of study. I'm actually in conversations with WSU right now to do a study to see if we can kind of get a sense of that, a snapshot of that. It's really difficult to say. But generally speaking, early on, we would say that for every 1 case, there were probably 3 to 4 cases out there that I just didn't know about. So if you look at the fact that, we've seen half a dozen cases this week, multiply that by a factor of 3 or 4, and that maybe gives you a sense. Again, the fact that 25 to 40% of individuals may be minimally symptomatic or asymptomatic without symptoms, that's of concern. And so that's where, again, I think it's really easy to let your guard down. I'm not feeling badly. I feel okay. I'm not having any symptoms. Oh, I can just go about my daily business. Just when I was leaving work today, I drove through Kendall Yards and I saw 5 young people sort of sitting on a wall eating lunch. Nobody was wearing a mask because obviously they were eating, but nobody was staying any kind of distance apart. And that's the kind of behavior that concerns me, because that kind of laxity is an approach which unfortunately can cause people to transmit disease unknowingly.
So it looks like if we're going by the phase 2 guidelines, which all indications are, what's the latest you're hearing about phase 2. I know that you, for example, were involved in an effort to try to petition the governor to sort of let phase 2 open up a little earlier. At this point, it doesn't look like it was successful. What's your office hearing about when phase 2 may actually kick in?
Yeah, with respect to that request, Darren, it went to Secretary Weisman, Secretary of Health, who makes the guidance for the governor's office. And as I shared at the time, and as I continue to say, that the challenge was that there was no guidance, there was no real, if you will, process by which phase 2 could proceed earlier for counties larger than 75,000.
Right.
There was a very specific process that needed to be followed for smaller counties, to include having no cases over the past 3 weeks. As you know, 9, 10 counties met those criteria. Ironically, Kittitas County was 1 day away from meeting the variance requirement for no cases in 3 weeks, and then they had an outbreak in a meat plant. And now they've had, I think, 34 cases over the last couple of days. So
Right.
That's the challenge. That's the challenge going forward. So I do not necessarily think that there will be an opportunity for Spokane to go to phase 2 earlier than the end of this month, May 31st. And quite honestly, in my conversations with some businesses, although I get a lot of pent-up frustration, I also find that, given guidance that's just coming out now, given some of the detail and some of the logistical challenges which need to be overcome to open up,
Mhm.
I think it gives businesses that time frame to say, okay, now I have guidance. Now I know what I have to do. I have to get PPE for my staff. I need to put up plexiglass screens in these situations. I need to be moving my tables around. I need to have these different things in place before I can open up. I need a plan. I need a written plan that's documented. This is how I'm doing things. So again, I think there's the devil's in the details. But again, I think that now that we're seeing these guidance documents coming out pretty regularly, I think that, to the best of my knowledge, unless something untoward really happens, May 31st is a really reasonable date to say we will be entering into phase 2 come June 1.
And so if that's the case, we're probably going to want to advise people to at least start a week in advance preparing documents. If I'm going through the list, that includes things like assigning a safety officer, making sure that all those rules and regulations are posted. Areas have to be sanitized regularly on a new schedule. We also have a 6-foot separation rule inside the office. Can you help us talk about that?
Yeah, again, that's it. Well, let me go back. I would encourage people to be doing the work now rather than just 1 week ahead of time. Again, I do believe this is going to be the guidance going forward that you will reference.
Okay.
And so with that in hand, start putting those systems in place that, again, come June 1, signed, sealed, and delivered, we're ready to go.
Okay.
With respect to the physical distancing things, it's again the balance that I'm mentioning to you. And that's where, again, I think the masks are a really good, easy way of sort of working within that physical distancing recommendation, i.e., if you're sitting across the desk from somebody and you are both wearing masks, yes, you are less than 6 feet apart, but you are providing each other that safety factor going forward. So, today, for example, when I was coming back from work, I stopped in a little pet store to get dog biscuits. And I thanked the vendor for having a mask on, and she thanked me. And it's this social norming, which is difficult for us because masks aren't something that we typically ask people to use. But certainly if you've traveled in the Southeast Asian countries, you know that it's very, very common. So, and it works. It works. And so again, I think it's a change in behavior, but it's a change in behavior for the good. And it's something that just a little simple thing of wearing a mask when you're out in public and you're coming in close contact with somebody. The fact that masks can be 60 to 85% effective, depending upon what they're made of in preventing transmission, that goes a long way. And so again, I think, answer to your question, when you're in that close proximity, give yourself that buffer by having both you and the person that you're working with, your client, wear a mask.
Yeah, when I'm talking about the masks, I know that cloth facial covering is sort of the minimum recommendation, but it also makes some references to appropriate. What would you suggest for companies that are trying to open up and have offices? What would be appropriate for face coverings in that situation?
Yeah, it does say masks, but honestly, any face covering is good. So, for example, I've seen these buffs that people wear sometimes, both cold weather buffs as well as warm weather buffs, something that's, again, just going to basically cover my nose and mouth. Masks can be kind of oppressive at times, and
Mhm.
they can be a little bit claustrophobic. They're not going to work for everybody, but something that fundamentally a covers your mouth and nose, and then also sort of at some level serves as a deterrent for you to be touching your mouth and face and eyes. Because that's the other thing that we need to keep in mind. It's frequently touched, it's frequently cleaned. And so, if you're giving a pen for somebody to sign off, maybe it's a new pen for each individual that you're working with. And you really need to ensure that as much as you can, avoid touching your face after you've been touching those frequently touched surfaces.
One of the things that happens at a real estate brokerage office is we often have lots of folks come in for meetings or for gatherings and things like that. As I'm looking at the guidelines, it's recommending a 50% rule. What does that mean, and help us understand how that might apply to a meeting setting like that for brokers?
Yeah, again, I think specifically, Darren, is talking about 50% of what you would typically, 50% occupancy. So I've seen that mostly in the context of restaurants, of where space, if your building can typically, or your room can typically accommodate 15 people, make it 20 for easy math for me, then that means that rather than 20 people, you have 10 people or 9 people. I think just that 50% rule is a good starting point.
And then the 6 foot spacing probably would be the
Right,
secondary guideline to look at that.
right.
And then
And I think,
so
and if I
next
may,
area that we go ahead.
if I may, I think, it's working with one of my colleagues who's really good at that whole sort of spatial piece. As Mark says, we would love you all to get an A plus plus, but the reality is that many of us are going to be okay with a B. And so you're not going to be able to accomplish everything by the book, but can you do everything possible to come really close to meeting the recommendations? We at SRHD are putting together sort of a checklist so that you'll have the document, the guidance document going forward, but we'll also provide a checklist for you. And we're working with GSI to get that out hopefully next week. And so both using the guidance document from Department of Health and maybe our checklist, you can then say, okay, well, yeah, we can do this. This is
Mhm.
going to be really, really difficult to do, but we're doing all these other measures. So again, I think it's, A plus ideal, B really good. I'm really happy if you get a B plus.
So would we. So one of the things that we also have is that we tend to talk to a lot of people. We tend to, and while a lot of our realtors have switched over to doing more Zoom meetings and more FaceTimes and more telephone calls than perhaps they've done in the past, there's still a lot of face-to-face activity, especially like for looking at a house, or even should we consider open houses and things like that, where there's a person's house involved. What kind of things might you recommend for us to consider when we're talking about expanding how many opportunities we have for people to go into a home?
Yeah, I think again, I go back to the frequently touched is frequently cleaned. So, for example, can you, rather than having the doorways closed, the doors closed, can you keep them open so you're not having to constantly touch the handles and things of that sort? How much touching do you really need to do when you're in a home? So really trying to minimize that. Obviously, there's going to be close contact when you're working with people. Wear the masks. Try to find space. You walk into a bedroom, and rather than like all looking at out the window, you're kind of like spacing yourself around the bedroom to take a look at that space. When you walk into a space, give yourself that distance. So it's one person goes in, take a couple seconds, the next person goes in, rather than all going in collectively. So I think it's those little things that mean a lot. And it's just, again, I think going forward, as you start to practice those behaviors, they become sort of normative practices, and then they just become routine. And I think going forward, I think we're going to have to be comfortable with doing things differently for quite some time.
Certainly is. One of the questions we got this week, quite a bit of, because it just seems like the information is all over the board, had to do with follow-up cases and doing this tracing, if you will, when a case happens. How do you anticipate that this process will work?
Yeah, as I've shared, as my colleague Anna, who's one of our epidemiologists, shared the other day on Facebook, it's really fundamental to basic communicable disease epidemiology. It's not unique to COVID. It's what we do with pertussis. It's what we do with measles. It's what we do with any kind of communicable disease. In this case, it's COVID-19. And really, having just gotten off the conference call with local health officers, Department of Health, and the governor, it is his top priority. I can tell you that he really believes, based upon the science, that the faster we in public health can identify somebody with a case, the sooner that we can identify who that individual has come in contact with and identify them so they can put themselves into quarantine, we really will be able to box in the virus. So I think moving forward, it is an essential piece of really trying to keep this at bay and preventing the resurgence from occurring. Because I think, again, the concern that we have in public health and clinical practice is that with opening up, we will allow that virus to come back into, more proximity with more people, and we'll see more and more cases. We expect to see more cases. The reality is we expect to see more cases. We just want to be able to contain them as best we can.
So if God forbid, I come down with the virus and I'm here with my family, what happens then? I'm guessing the family would be in quarantine for a set period of time? How'd that work?
Yeah, exactly, Darren. Yeah, so essentially what we do is the individual who is identified as the case, he or she, in this case yourself, you go into isolation for a minimum of 3 days where you have no fever, without taking medication, your Tylenol, your ibuprofen, what have you, and or up to 10 days where you are symptom-free, whichever takes longer. So at the minimum, you're looking at probably 10 days from symptom onset where you are out of isolation. Conversely, for those individuals who are in quarantine, and again, those are people at risk, unfortunately, you're quarantining for 14 days. And so there's that sort of distance the difference between the number of days in isolation you're infected versus the number of days where you could demonstrate that you've been infected by having symptoms of 4 days. So that's, again, sort of the challenge. But when you're in isolation or quarantine, again, you're trying to minimize as much as you can your interactions with other family members. Difficult, but possible. And certainly that's also going to limit your interactions with the public.
There were some concerns that just to help save my children, they could be pulled out of my home. What's your thoughts on that? Is that a possibility?
By whom?
Well, there's either your department or someone with the state. Is there any provisions at all that would take people out of the home to try to spread them away from that?
No, I mean, again, this is one of those conspiracy theories that's really, disappointing, but it's out there, and it just takes a little bit of that to sort of spin itself out of control. Trust me, I'm not sending the sheriff into your house to pull your kids away from you. It's not going to happen. It really does come down to self-isolation or self-quarantine. And what I try to emphasize is that you're doing this for everyone. You're doing it for yourself, but you're also doing it for everyone, because the more cases that get out there, the longer we're going to stay cooped up and sort of locked up. So we've not, to date, of my almost 400 cases, we've not had significant problems with people not willing to follow through with self-isolation. It does become difficult, though, in some situations where, again, people are trying to make ends meet. And in that case, we do try to provide resources for folks. So we've been able to work with a local nonprofit. It's an opt-in program. But if you opt in because you have some resource concerns, then a volunteer from this group will connect with you. They have resources, and they help to connect the dots for you. So we're trying to make it as easy as possible.
So what do we do about secondary cases? Like, so for example, if I've come in contact with somebody during the job and they are now considered, say they come down with it, but my interaction may have been minimally, but I was in contact. Well, what will happen in that case? Will you give me a call and say, watch out for symptoms? Would you ask me to self quarantine? What would you think?
Yeah, so I mean, typically during our isolation conversations, we typically find that the number of contacts that we have, averages less than 4 or 5.
Okay.
And so, if you find yourself, if, for example, hypothetically, you came in contact with somebody, you were showing a home, that person came down a couple of days later, sick, was diagnosed, we would reach out to you and say, hey, you came in contact with Mr. Smith, and Mr. Smith is now positive. here are the things you need to be doing. We encourage you to be self-quarantining because of the risk for you and for others. And these are the things that you need to be looking for going forward.
So this is great information. I really appreciate you taking the time here. And then I guess lastly, we're all kind of, I think we're all eager to get back into to another semblance of back to somewhat normal. We're realizing it's probably never going to be the same. But what's your anticipate of how the rollout will be here moving forward through the summer, as far as like moving into phase 3 and phase 4?
No, actually, the conversation I was just on was kind of looking at those metrics that will allow us to move forward. I don't think necessarily, I don't want people to have the expectation that if we move into phase 2 come June 1st, automatically we're going to move into phase 3 in 4 weeks. I would like to say that that's an expectation, but I also want expectations to be met. And I can't promise that. And so that's where I think these metrics are not going to be hard stops, but they're going to be guideposts. They're going to be able to kind of give us some guidance going forward. They're sort of like guardrails, and not all are going to have to be met, but there are some that are of concern. So for example, if I find myself with multiple outbreaks across the community, it's going to be difficult for me to say, hey, I feel comfortable going forward. If, however, I have a couple of outbreaks, but I can quickly contain them, then that's again something that's very reassuring. If I have multiple hospitalizations where all of a sudden hospital capacity is really being stretched, that's of concern for me, because obviously much of the efforts that we've been doing in the past have been trying to mitigate issues at the hospital level. We want to be able to ensure that hospitals can function as they need to. So, we have metrics. Again, I think they're going to be sort of like guardrails, not absolutes. But I do feel come June 1st, unless something really untoward happens over the next couple of weeks, we should be able to move into phase 2. And then once we're in phase 2, I think there will be ongoing conversations between those of us at local public health, Department of Health, the governor's office, saying, well, how exactly do we move into phase 3? Are we looking at the same metrics? Are we looking at the same guideposts going forward? Or if we go backwards a little bit, does that put us back to phase 2? Does that just kind of keep us in a holding pattern? Again, I think there's a lot to be defined, which is challenging. Trust you me, I wish I could tell everybody that, well, come June 21st, you'll go into phase 3, and then come mid-July, you'll go into phase 4, and voila, come September, you're back to a functional normal. I can't say that yet.
From everything you're saying, I guess the last thoughts would be kind of your crystal ball. What's your best speculation for the fall? Do we anticipate that there will be another upswing on this, or is it the kind of thing that'll stay more linear? What are you thinking?
I think all of us are very concerned about an uptick, just based upon changing in behavior, based upon history. Granted, we've never dealt with a pandemic from coronavirus. We've dealt with pandemics from flu and other types of viruses. The pandemic event of 1918, the Spanish flu, as a reference point, the virus mutated. And as a result of that mutation, it was much more aggressive with a different population. And so rather than it traditionally getting the young and the old, it got the young and the old and the young individuals between 20 and 45. And so there's a lot we don't know. The fall, school's back in. We know the fall is always cold and flu season. So if we have an uptick in flu cases, if it's a bad flu season for us, we don't have a good match with the vaccine. A lot of ifs. And I kind of wish that I had more definitives, but the ifs make me concerned about an uptick. And so I would rather go in prepared than to go in cavalier and find that, wow, I wasn't prepared for this. We need to hunker down again, because none of us want to go here again.
Agreed. Dr. Tep, we've got a really good scope of documentation that you're going to next week, and we're also hoping for something specific for realtors to come from the governor's office. That should hopefully come out this week as well as we start to make our plans. Tom and Matt, any questions or thoughts you might have? And Dr. Lutz, I'll give you one last chance if you want to help us wrap this up.
Like, in public health, we talk about making the healthy choice the easy choice. And I really encourage all of us. For me, you know, I sort of rhetorically ask you, do you care about the health of the public? Everyone's going to say yes. Then I would say you're a public health advocate. You're a public health practitioner. Make the easy choice the healthy choice, and make the healthy choice the easy choice. Make it easy for your customers and clients to know that you're doing everything you can to get that B plus, shooting for an A. You're going to make it safe for them so that you can get back to business.
Excellent comment. Tom and Matt?
Nothing from me other than thank you very much, Dr. Lutz. Appreciate your input and your thoughts. I don't think you'll talk to a larger group of community supporters as you do in real estate. We're very sensitive to our community and very sensitive to the health of the community. And so your comments and your insight has been invaluable. Thank you.
Much appreciated.
I would echo Tom with that. We really appreciate your leadership, and especially when we're talking about changing social norms and things like masks that can sometimes be challenging to adopt. I just know from my perspective that the leadership of saying, "Hey, we just need to do this and make this more normal," makes it easier to do. So appreciate that.
Appreciate it. Thank you.
Fantastic.
Great.
All right, Tom, I'll turn it back over to you. And Matt, maybe you can give us an update on what's happening with the Young Professionals Association.
Absolutely. Well, Young Professional, one thing that is true about YPN is that most of our interactions are very social. So those have been kind of kiboshed, as all of us know, but we have been doing weekly masterminds. Just this week, we had Jimmy Mackin from Curator, who is honestly one of the greatest minds in marketing, and we were able to interview him on a Facebook video, and I know Tony's working on seeing if we can get that reproduced so that people that missed that can gain knowledge from that. What's coming up next week, we are doing a huge fundraiser for ACOIN. ACOIN is the American Children's Cancer of the Northwest. That's one of our charities that we promoted last December. And as with all nonprofits, many of their fundraising events have been canceled. And so that has left a huge hole for them. So one of the things that ACOIN does is it really becomes an advocate for the families of cancer patients who are children. And so whether that's gas cards or cards to restaurants so that they can eat, because many of them come to Spokane from out of area, help with hotels, bills, those type of things. That's really what their mission is. And so we're really excited because we're going to be partnering. We're going to have a kind of a double duty on this one because we've partnered with several local restaurants where our constituents here in the Association of Realtors will be able to donate money. Their donation will be gift cards to local restaurants so we can help our local businesses that need help right now. And those gift cards are going to go to families that are in pretty desperate situations. So we're excited about that. Watch your emails and our Facebook page on Monday for the details on that. But that's a lot of what's going on over here at YPN.
Fantastic.
Thanks, Matt.
Absolutely.
I think one of the interesting things about the challenges we're facing today is it's causing many of us to think outside the box. Maybe think of ways we can have a positive effect on the community without being so busy in our own business, if that makes any sense. And so the fact that we may have a little bit more leisure time, a little bit more time to think of how we can have an effect on the community other than through our business, I think speaks volumes of the people that are in this organization.
Yeah, absolutely. It is that thinking outside the box. And Bree Campana, who's our community director, kind of came up with this inspiration on how we could both impact our local businesses and help a nonprofit that's struggling right now. That's exciting.
Yeah. What, from a standpoint of you're a broker owner and a business leader also, what kind of challenges do you see your associates running into that we didn't anticipate with this virus? Just about everything, I suppose.
That's a really big question, Tom. I think it's going to be an interesting challenge to begin to reopen offices. I think that today's conversation was really important, that it isn't going to be business as usual for a while. And as advocates for our community, we have to remember that we need to make people feel comfortable and safe. And whether that's our employees in our offices, our clients that we're working with. I loved what Dr. Lutz was talking about. Like, when we all take certain precautions, then we're focusing on other, right? Like, it's really easy for us to kind of focus in on what is important to me and forget that there are other people in this equation. So I think that that's going to be a bit of a challenge. Just the logistics of, reception areas and those high touch points in our office, and making sure that grocery stores have obviously figured it out, and they looked at the places that they needed to put up plexiglass and putting their little stickers on the floor, so we know where 6 feet is. And so I can see that being an interesting challenge. But I was reading in the paper today, and it was kind of inspiring to say that there are essential businesses that have been doing this now for a couple of months. And so we should look at what has been working and not try and reinvent the wheel at the same time.
And it's probably too late to invest in plexiglass.
Or Zoom.
Would have been a good idea a few months ago. I've been reading the NAR workplace reentry checklist, and I don't know if you had an opportunity to look at that. The list is unbelievable. It's like, holy smokes, there's almost 20 things to do just to prepare your workspace. It's like you got to have hand sanitizer at the bottom of the stairs, hand sanitizer at the top of the stairs, hand sanitizer by the time you get across the room, and masks and gloves and booties, and take your pick. So it's pretty amazing the extremes that I think we're going to find ourselves going to protect everybody around us.
Yeah, and I think that what Dr. Lutz was saying was, don't wait until. I appreciated that too. And when Darren was kind of like, well, when kind of start preparing, he's like, start preparing now, because it's going to take you some time to get these pieces in place.
Right. So anybody that hasn't read the NAR COVID-19 workplace reentry checklist of May 7th, it's an enlightening read. And then Washington Realtors has a phase 2 professional services COVID requirements also that are interesting to read.
I think that's going to be, I was just going to say, that's going to be important, Tom, to kind of merge the two together, because NAR is obviously looking at it from a national kind of broad perspective, but obviously our state and our county are going to have our own guidelines as to what's important or required. And so kind of merging the two of those together.
I think another
which Darren just posted. Thanks, Darren, for posting that.
Yeah, thank you, Darren. I think another challenge that we face as realtors is from a leadership standpoint. We have contact with the public. We have contacts with each other. There's a lot of frustration. It seems sometimes that Lucy just pulled the football away from Charlie every time that the goal line moves on us. And, it's unfortunate, but that creates frustration. That creates frustration, and that can create some negative feelings. And all of a sudden on Facebook, you see a whole bunch of negative dialogue with people that are, hey, tell me who's going to work now because I'm going to go support him, instead of taking the cautious mode. I think somewhere in there lies a happy medium, and somewhere in there, the cooler heads need to prevail.
Yeah, I would agree with that. And I think that anytime you have kind of opposing viewpoints, there's the extremes of all things, right? And I think that when we find that middle ground is where it's important, obviously, to do that. But I also believe that sometimes it's the tension of the opposition that helps us find the middle. And I think one thing that I have for myself, and I hope that as a realtor community we really embrace, is what you said earlier, Tom, which was focusing on the other, right? Like paying attention to the fact that we can be leaders in this even when we don't agree with some things. And I don't know, I think that's important, that because I might not specifically agree with something doesn't mean that I should push that perspective on my clients or my employees or the people that are in my office, especially if that potentially jeopardizes their safety or their perceived safety.
I'm reading, Christy. Where did Darren post? Oh, just above that.
Just in the in the chat comment,
in the
Christy,
chat
is a
comments.
link
Christy, there's
to
the post with a link to the COVID-19.
And also, if you'll check your notices from today, that link is also on the notices.
Perfect.
The other place too that I found it, if you're having a hard time finding it, is if you go to Spokane Regional Health District and you go to their COVID page, they've got updates that are happening, and the newest one is a link to the different phases on the Washington State site.
Good. Yeah. Darren, what thoughts have you got while we were batting some ideas around?
That's it. We are. It also was a great week. We were all supposed to have been back in Washington, D.C. this last week, but some of the national seminars they're online, and they're very worth looking at. I mean, whether you're interested in the direction for what's happening with real estate moving forward, and some, the economic perspective of what's going to happen to the country, and what Dr. Yoon is thinking, and also just politics. There was some great insights into what politics are going to do for the next year or so. We have a presidential election coming up. Some nice insights being offered by the panelists that were there. And I highly encourage you take the time to go back and look at those things. So they really are good information. And other than that, we should just stay tuned. We should see more guidance this week from the governor. And hopefully we'll have a better handle on phase 2 for realtors. If that's going to be on the 1st, it's going to be moved back, it's going to be moved up, we'll know. So
we'll see where the football is when,
stay tuned.
We'll see where the football is when Nancy stands up. Yeah, time will tell. You mentioned that the national legislative days, and there were some other things on there, the political stuff, but also I watched Dr. Lawrence Yoon. He's like extremely highly regarded economist in the country, not just for the National Association of Realtors, but a national figure. But then also shortly after that was a presentation by Brian Buffini, the real estate coach, and he wasn't recruiting. He was he's had a whole lot of statistics and a lot of examples and some business advice for each and every one of us. Of the thing that intrigued me was he used a NASCAR analogy, which in NASCAR, when there's a crash, the yellow flag comes out and everybody comes to a stop, right? And then they're just barely going around the track, not even keeping their tires warm. And then all of a sudden, when the track gets cleaned up and the safety issues are no longer there, and the accident and victims and everything have been taken care of, they do what's called a rolling start. And so that's kind of what we're doing right now, is sort of a rolling start. And when you see the rolling start on NASCAR, maybe some of you can visualize it, because I did. They're zigzagging and warming up their tires, right? They're warming up their engines, they're warming up their tires, and they're going 40 miles an hour, and then they're going 50 miles an hour, and then they're going 60 miles an hour. And pretty soon they're, the pace car pulls off and off they go. And we're kind of in that rolling start thing right now. And if during the rolling start we have a few more crashes, it's going to cause a lot more grief for us than if we do take our time in the rolling start and ramp up slowly, so that when we get to speed, we're in control.
That's a great analogy. I think that's one of the interesting, benefits in some respect of everything kind of having to go into this remote world, is that it's not always feasible for everybody to take time out of their week and fly to DC and be a part of these conversations. And yet, we get to be a part of those through Zoom and video and those type of things. And so that's one thing I would encourage, just having gotten involved in the Association of Realtors, both on the state and the national level over the last year. It's been a great experience. And I know that not everybody has that opportunity, but this really has offered an opportunity for people to plug in and not even have to leave their house.
Right. Darren, that might be a good link for you to put up also for those, for the presentations you listened to.
Legislative days.
Yeah. Well, that concludes our enjoyment for the day, I think, for me. Matt, Darren, any final thoughts?
That's it. We'll see you again next week.
Thank you,
We're
everybody.
going to
Appreciate
get,
it.
we're working on trying to get better guidance for reopening, and we'll hope to put maybe some guidelines out as well as soon as we get them from Washington Realtors.
That's great. Thank you again for helping us navigate all of this. It's just the resources have been amazing.
Absolutely.
For
That's great.
brokers, broker owners. Thank you to
Yeah.
the association.
And I'm sure Edward would outdo himself again and have this link up for people that didn't get to watch to tune in later and listen to Dr. Lutz and some of the insight. So thank you again, everybody. Have a great week. Please stay safe.